It's morning at NTV, Stephen Imbide and Professor Chibuga. Today is the World Mental Health Day. This brief conversation is going to help the employers and the employees on taking care of themselves, but also know why it's really important to take care of our mental health. I'm here with Susan Tasheria. She's the CEO, Koha, the Director of Rapport Counseling and Wellness. Good morning to you.
Morning, Stephen. How are you?
Okay. Good. Why is it really important? I know today's World Mental Health Day. Why is it really important for employees and employers to take care of the mental health?
Thank you so much. There's a link between mental health and work. If there are difficulty conditions at the workplace, they definitely affect the input from the employees, and that affects productivity. And so the theme this year is mental health and work, which is very important for employers and business owners to take seriously the mental health of their employees, because it feeds into each other. Now, out of experience, we have realized that when an employee has mental health challenges, it's going to be very difficult for them to be productive at the workplace. And that, of course, brings the output puts the output low, and it affects both their health and their lives. So it is important for workers' mental health to be prioritized at the workplace. And it's good this is coming up. It is one of the areas that have been ignored for a long time because, again, of the challenges we have as people where we do not value mental health. But it has come to the limelight that actually a happy and mental well-being is very productive and can contribute positively to their society or to the organization.
You know, when you talk about the challenges, you know, it's not really easy for an employee or an employer to come to the staff and tell them, you know what, I'm doing with these pressures. They are also keeping me busy or keeping my mind away. So how can the employees identify that I'm having a challenge? How can even the employer know that these employees, my staff, are going through difficulties that can break them down?
The first thing I would advise or talk about is knowing your employee. How do they behave and how have they been behaving before? And when there's a deviation on how someone behaves and how they present themselves, that can tell you that there must be a problem, and the lifestyle they live. That can help the employer or the manager to understand that there could be an underlying problem. Because most of the challenges employees get are not necessarily stemming from the workplace, out of experience. Some of them come from their personal lives, and they bring this to the workplace, and it affects their productivity. So some of the things they need to pay attention to is changing behavior and also how someone has been performing. For instance, if someone has been an active employee, is always present, is always active, and these things are not there anymore, there must be a problem. But also the managers and supervisors should have a relationship with their supervisees, so that they are able to have an interactive conversation with them to be able to help them open up and express themselves and get help. Also providing programs like employee assistance programs where these employees can be supported and their families to address their issues or personal challenges that affect them on a daily, so that they do not bring those effects to the workplace and affect them as they perform their duties.
Thank you, Susan. But as we wind up, I want also to understand, you know, there are people who are going through effects of COVID-19. Some people have domestic issues. Some people even going through a lot. These people, how can they bounce back? How can they give maximum productivity at workplaces, but also live a healthy life, because you know this mental illness, mental unwellness can bring you down completely and you lose it all.
I would advise that people should start looking at mental health the way they look at physical health, because without mental health, there's no physical health. And so when you feel that your mental health is at stake, for instance, people could be experiencing lack of sleep. They could be having difficulties in eating, having body aches, and they are irritable all the time. Those are some of the signs one needs to look at and pay attention to. Help is available because we face many challenges in life. Where do you go to? There are professionals where you can go and seek help. You can look for a friend whom you can confide in and find support, or open up to and be supported. There are programs that have been provided actually by many employers at the moment, which people are not utilizing at the workplace. Programs like employee assistance programs or counseling services. It's high time that we break the stigma that is associated with mental health and take it very easy for us to go and approach a mental health practitioner and share our experiences and the difficulties we face, so that we can be able to find help and support before it progresses into mental health diseases.
Thank you so much, Rotarian Susan Tashiria, of the Director, Rapport Counseling and Wellness. Thank you so much for your time.
You're welcome.
I have now turned you back to studio for Priscilla Naroga in the studios.